Usually, the birth of a child is associated with great happiness in all our households, but we have to be very careful of a very important problem which can arise in the new mothers, and that is postpartum depression. Why does it arise? Well, a new mother goes through 9 months of carrying the baby within its womb, and then the difficulties of childbirth, whether it's a normal labor or it's a surgical cesarean section, it all has its own difficulties. Then the caring of the newborn, the added new responsibilities, and a lot of hormonal fluctuations. There is a complete seesaw of hormones going on in the new mother's body. We have to definitely identify this as a disease. It has to be labeled as a disease and it has to be treated accordingly. Postpartum depression has some important signs and symptoms, such as a feeling of hopelessness, incessant crying or episodes of crying, not taking care of your own self, not showing any interest in the newborn baby, not wanting to breastfeed the baby, not really feeling, up to the mark, and sometimes it can also lead to feelings of intense anxiety, intense mood swings, even suicidal thoughts. Obsessive compulsive disorders can also arise as a form of postpartum depression. The important investigations which can be done are especially looking for the micronutrient and the vitamin deficiencies. We have to be careful for looking into vitamin D and the whole spectrum of the vitamin B12, vitamin B, B3, B6 deficiencies. And if needed, even if we do not get these investigations done, we can start supplementation with B12, B3, B6. Magnesium, especially in the form of magnesium glycinate, is a very, very important supplement. We can also start supplementing with selenium, with zinc, with omega-3 fatty acids, and also most of the B12 vitamin range. When we come to the important food which such newborn mothers can have who are facing postpartum depression, please focus on good quality protein especially in the form of eggs, or in the form of paneer and curd. All of these are very, very important. Please add nuts, add seeds for their good quality fats in it. Also, we can add curd is also a very good form of probiotic. Lentils and legumes give us also a very good source of nutrition. We should also focus on hydration and electrolyte imbalance, because breastfeeding can cause a lot of dehydration and a lot of electrolyte imbalance. So addition of simple electrolytes in the form of coconut water, in the form of charge, all of these can are beneficial and can work wonders for postpartum depression. Please encourage the young mothers to walk as soon as they feel up to it. Let them go around for walks inside the house. They can also start walking outside the house. Post-pregnancy yoga works wonders in such cases. So please encourage the young mothers, the new mothers, to take up yoga, to take up pranayam, to take up deep breathing exercises. A word of caution here: if in spite of doing everything possible, good nutrition, good supplementations, you feel that the young mother, the new mother is actually going into severe postpartum depression, she's unable to take care of herself or the baby, please consult a counselor, a therapist, and if needed, a psychiatrist, because sometimes medications are needed to overcome this issue. So, as much as we all would love to enjoy our pregnancies and to really see the birth of a new child in the house, it's very important to completely focus on the new mother, because sometimes postpartum depression can have devastating effects on the family.